So when you hear a stat like 50% of undiagnosed HIV cases are in the South, as someone who is doing a lot to combat that, what do you think?
So I think that we have to do a better job diagnosing it.
Dr. Leandro Mena strives to do better. He's the medical director of Open Arms Healthcare Center, a clinic designed to address the alarming rates of new HIV infections in the Deep South.
So how important is it between contracting HIV and getting the diagnosis? How important is that time frame?
Oh, it's super important. I mean, the shorter is the time between infection and diagnosis, and between diagnosis and treatment, the less likely that person infected with HIV will infect someone else.
What about patients who return for follow-up appointments? Do you have trouble with retention at all? Or is it because this is a little more friendly and honest clinic, they're more likely to come back?
Whether people, miss appointments, we really, acknowledge all these social determinants of health, lack of transportation, food insecurity, unemployment, low income, and try
Side effects
to do
of larger problems.
Exactly, and try to address them.
And address them they do. No cars to make your appointment? Open Arms will pick you up. Can't afford food? They've got groceries. Need the internet to look for a job? They'll give you the Wi-Fi. Want access to mental health care? Come get counseling. No insurance for a routine checkup? They've got sliding pay scales. It's a one-stop shop to treat all types of life's problems. Problems Mena wants to ensure Washington policymakers remember.
When you hear someone like President Trump say he wants to eradicate the spread of HIV by 2030, what do you think when he says that? And two, what are tangible steps we could do today?
It was a bit of a surprise,
Sure.
to hear that. But it's something that, again, at the same time, you say, well, why not? That's an opportunity. And certainly, in many ways, we have some of the tools, that can help us to end the HIV epidemic. We have treatment, and we have prevention tools that are very effective. The question is, again, is that how do we, create the systems, to make sure that those tools reach the population that need them the most?
A solid question, and I went to the Mississippi Department of Health to figure it out.
If you compared Mississippi to other states in the country, not only do we have these sort of barriers, but it's almost like we're in a time warp. We have to go back years before.
This is Dr. Thomas Dobbs. He works as the state health officer in Mississippi, and it's his job to implement high-impact solutions for Mississippians most at risk for HIV.
Mm-hmm. And so our real challenge is actually testing the populations that need to be tested. And it's a resistant population because of the stigma.
Sure.
And people are scared and really don't understand. The health literacy around HIV is not really advanced in a lot of areas. People still think it's a death sentence, right? They don't understand. People are afraid it's going to change their lifestyle.
I get stuck on how do we change that? How do we change the resistant community, and how do we get resources to the rural areas?
From the healthcare perspective, that's the most rudimentary sort of easy thing to do, because you put a doctor or a nurse practitioner in a location and give them access to services. That's an easy sort of like strategy to do. But then how do you penetrate the stigma barrier, the education barrier? It seems daunting, but I think we've made progress.
So the biggest difference I see when I go from a place like Chicago, where I live, to Mississippi is public transit or billboards. I'm seeing ads of men kissing men, talking about PrEP. You ride a train in San Francisco, you see that. So I mentioned that to Open Arms. I'm like, is there any talk about that in Mississippi? They're like people would die. So it's like, when you hear that, do you think that's an option one day for Mississippi, or do we gotta work it in a little slower than that?
I think work it in slower.
Okay.
Yeah.
What's your dream campaign to just raise awareness?
I think just that HIV care and prevention is just like anything else.
Okay.
It doesn't have to be singled out. You don't have to ask someone to sign a consent for an HIV test. That's stigmatizing right there, right? And we thought we were doing it years before because we wanted to protect people's rights. But really, it's become this separate universe of healthcare. And let's just make it part of the normal thing. And Mississippi, people don't want to see boobs on the billboards, and so they want to see a man kissing a woman, to be quite honest. It's a very conservative sort of thing, and maybe that's okay. But maybe two men holding hands, saying, hey, get tested, that's the right thing to do. Something that's kind of more Mississippi-fied.
Mississippi-fied. Yeah. Okay, that's a good word. We're taking that with us. anything else you would like to see more from a federal level that would make your job a little easier?
You know, a little bit more flexibility in funding. Now, I'll be very thankful. I mean, without the federal support, we wouldn't be where we are in our programs to kind of treat people with HIV. The approaches that might work best here might not be the best approaches for other places, and maybe be able to sort of individualize, be held accountable, don't get me wrong, but be able to approach it from a culturally appropriate level for the society, particularly the religious society we live in, because even people who are at risk for HIV have a strong faith community. And so that's a lot more than other places. So we have to respect the cultural parameters within which we live.
So, I mean, is it a disadvantage to be living in Mississippi with HIV right now?
It is.
Yeah.
Yeah, it is.
That's unfortunate, isn't it?
But people who live here like living here.
Yeah.
You can kind of really press your point, but in a respectful way, because if you're disrespectful of somebody's cultural heritage, even the advocates who might help you, sometimes you can undermine your case.